Hello everyone, welcome to my channel Physio Patsala. So in the series of electrotherapy, the low frequency current, we have already uploaded the 30 current, and second part is galvanic current, and this is the second video of the galvanic current. So let's discuss about therapeutic effect, indication, contraindication, advantages and disadvantages. So let's discuss one by one. So what is the therapeutic effect? So if we are applying the muscle stimulator, which is galvanic current, over the treatment procedure of the patient, so what is the therapeutically sown into the body? So first we have to sow the iontophoresis. What is the meaning of iontophoresis? Iontophoresis it means the delivery of the drug via galvanic current through the semi-permeable membrane onto the skin. So the medication which is transferable by into the skin by the semi-permeable membrane. I'll take one example, which is hyperhidrosis patient. Take the normal tap water, inducing the galvanic current for treatment. Second one is vasomotor changes. What does that mean? It means the vessel is to be stimulated or dilate to increase their circulatory changes and reduce the chance of hypoxia or ischemia. So increase the local blood flow. Third one is pain modulation. It means if patient have suffering from the pain also in the spastic or fallacic kind of condition or paralysis, on that time it will be so the if we are applying the galvanic current, iontophoresis also perform the analgesic effect into the body. It is normal and analgesic zone if we are applying the galvanic current into the tissue interstitial site. Next is to be tissue healing. The sluggish kind of body or the like inflame or like swelling if have person into the particular region. So on that time we are applying the galvanic current. The therapeutic effect there have to be tissue healing is to be so. Polar chemical effect. What does that mean? If we are inducing the iontophoresis, which is direct current, direct galvanic current, which is a sodium hydroxide, which is reducing the pain receptor, which is into our body, which is A fiber and C delta fiber, and which is present in our cathode, and in the acidic reaction is to be shown into the anode side, and the chemical which is goes into the body into the iontophoresis reaction, which is hydrochloric acid. So that is the polar chemical change. There has to be a chemical sent into the body via like this is the tub, and there is a water, and the hydrochloride into the water. There is a one pad into the water, which is cathode, and one pad touches the patient body, uh, or also the both of the leg into the both of the leg inside the water of the patient, and patient is sitting down. So the polar reaction and polar chemical effect has to be shown, and affected leg or which is affected leg or like pain or inflammation. So on that time, hydrochloride acid has to be shown into the body to decrease down the pain and swelling over there. So that is the therapeutic effect. So you have writing your state examination. What is the indication? Indication, it means where we have to be applying, which condition we have to applying and taking the galvanic current. So first is inflammatory condition to reduce the inflammation. Second was hyperhidrosis. So hyperhidrosis taking the iontophoresis, which is continuously direct electric current, and the medication is to be the normal tap water for the reduce the hyperhidrosis, and the sodium hydroxide for reduce the inflammation. Next is to be chronic dermal ulcer. So if patient have to be like a dermatological region ulcer, which is chronic and in between the scar, so on that time we are applying the galvanic current to increase or facilitate to the systemic circulation over there, or increase blood flow to like formation of the scar tissue or the healing. Second one is like aesthetic desiccation. A desiccation, it means aesthetic is mean basically that is used for by into the dermatologist doctor, which is a deep cleansing facial treatment where we can taking the pen electrode or the facial massage over there to going to the deep facial pores to like cleansing out or extract out the dirt material which is inside our pores. So that is the aesthetic discolorations of use for the dermatologist by the galvanic current, which is for an electrode. Fibrous scar, it means any scars tissue which has to visit and have to be not proper recovery. On that time, galvanic current help to increase the circulation over there and rigid scar tissue converted into the soft scar tissue. So that is the indication of the galvanic current. Next is to be contraindication. Contraindication, it means where we cannot induce or use the galvanic current. So first one is acute implanted device, which is pacemaker or any kind of other device which is induced inside our body to facilitate any kind of bodies of function. So contraindicated, we are not using the galvanic current. Metal implantation, we are not using the galvanic current like TKR, metal implant or screws or knots. On that time, we are not using galvanic current because there is chance increasing to the burn. Dented or broken skin. What is the meaning of dented? Like open wound, there is the hemorrhagic condition, so there is a pain and swelling is there. So indication is to be inflammation condition, the galvanic current is to be used. But there is a dented or broken skin, we are contraindicated, we are not using the galvanic current until unless the dented or broken skin is to be covered up or like into the healing phases or like covered up by the primary or secondary healing inside our body. Malignancy, which is a cancerous cell which is developed into our body. So on that time, the inflammation and swelling was to be there. So inflammation is to there, but we are not using the galvanic current because it chance to increase or facilitate to cancer cells or carcinoma cell, which is tumor, to increase their number fastly. So galvanic current in malignancy is to be contraindicated. Also the pregnancy, because its chance to be increased to be burned, so contraindicated for the pregnancy. What is the advantages of using the galvanic current? So first is targeted drug delivery, which is iontophoresis, to easily transfer the drug into our body. Bypass the GI tract, it means it doesn't harm into our gastrointestinal tract because it not reached out into the deeply muscles or like tissue. Side effect or doesn't show any kind of side effects inside our body. Non-invasive method. Galvanic current has shown invasive or non-invasive method, but many clinically or hospital use non-invasive method, so it is non-painful method. So we are using highly effective for hyperhidrosis patients. So in medical, clinical, and hospital treatment, the iontophoresis into the galvanic current, it is treatable by the hyperhidrosis patient, is to be shown the highly considerable for the treatment procedure for the hyperhidrosis patient is to be like decrease their condition of the hyperhidrosis into the oversweating into our body. So that is the advantages of the using of galvanic current. Next is to what is the disadvantages of using galvanic current. So high risk of chemical or electrochemical burn. So this chemical is to be since highly sensitive for the particular patient, it varies for person to person. So it very more chance or more closely or more prone to cause the chemical burn inside the body if you are using any kind of chemical like sodium bicarbonate or like calcium bicarbonate or any normal tap water. It depends upon the patient body. Depth of the penetration is limited. It means in the non-invasive method, their pad electrode is to be used and the superficial nerve and superficial muscle has to be stimulated and triggered to re-educate and denervated to innervated or like stimulate over there. So that is the disadvantages for not reaching the deep tissue or deep muscle. Demand constant precise monitoring of electrode moisture. What does that mean? If we are using the pen electrode, so make sure you are applying over the trigger point, not into the all over the region. So all that time, that is the disadvantages of the galvanic current. Last is to be can cause an uncomfortable sharp pricking sensation. What does that mean? In last video we have discussed about the sawtooth and there any kind of different kind of types of the galvanic current. So sudden increase or decrease, the sensation is to be pricking or like tingling sensation have to be like gradually, not like suddenly increase, and sharp tingling pain is to be on the skin and suddenly decrease on the patient. So that is the meaning of the uncomfortable sharp meaning. Or also in new research and hospital practice, the many practitioners has to be used invasive method to like needling inside the body, and electrode has to be stimulate the deep muscle or deep tissue for the muscle re-education. So that is the disadvantages of the galvanic current. So that is for today. Thank you.